Wonderful. So welcome again to today's Community Ambassador Training on Vaccination Passports. I will now turn it over to our presenter, Jeffrey from Toronto Public Health. Thank you.
Thanks, Shahina, and thanks everybody. And thanks, Shahina, for giving that quick disclaimer on my ability to talk about the proof of vaccination policy, which was created by the province of Ontario, and it's a provincial policy, but not really my ability to speak to why certain policy decisions were made, because again, it is a policy of the province, and I work for Toronto Public Health, so I work for the city, so I just am not part of those conversations where I'd be able to speak to those things. But happy to share everything I can with you about the proof of vaccination policy to help you understand it better. First, a very quick introduction. So yeah, Geoff Gillard. The way you said it, Shahina, sounds much better, but it is Gillard, unfortunately. And I work for Toronto Public Health. I have two roles there, really. I was brought in to be the Toronto Public Health lead for public engagement, to work very closely with Daniel Bonde and John Smith and the whole team over there. So, you know, my role is really to support their work as they support your work, to make sure that it's all connected to public health information as it changes and evolves, and that you get, you know, questions to your answers, and we can all make sure that we're communicating the correct information to the people of Toronto. So that's my core role. But over the course of doing that work in my first couple of months with Toronto Public Health back in February, March, April, a couple of issues arose that you know, I got attached to as a lead for Toronto Public Health also. So one of those, I think you'll be familiar with both of them. So one of them is where someone doesn't have an OHIP card, an Ontario Health Card, and initially, in order to get vaccinated at one of our city mass immunization clinics, and subsequently, in order to get the vaccination records from the province, it had been difficult to do that without an OHIP card. You need something called a COVID ID. So I'll reference this in the presentation. And so I lead the team of people who provides those COVID IDs, in partnership also with several wonderful community agencies who are part of the Vaccine Engagement Teams program. So you know, happy, it's not the focus of my presentation, but happy to speak to anything there as we get into the question and answers. And then the other part of the other team I lead within Toronto Public Health is the team that supports people who got vaccinated outside Ontario. So whether that was 1 or 2 doses, you need to have that vaccination recorded in Ontario, in Ontario's COVAX vaccine management system, in order to be recognized as fully vaccinated here and to get that vaccination certificate with the Ontario letterhead, et cetera. So my team does that as well. And I do reference that also in the presentation. Happy to take questions on that. So that's me. Jump into the presentation now. Oh, hopefully, what's going on? Oh, here we go. Okay. So first, what is the policy? What does it do? So the policy states that people must, oh, sorry. Oh, is there an issue? Okay, sorry, I'll just continue. So the policy states that people must prove that they're fully vaccinated before entering certain indoor spaces, many of which are businesses, some of which are establishments run by you know, municipalities and organizations. And the ones that you'd be most familiar with are restaurants, bars, nightclubs, also sport and recreational facilities, meeting and event spaces, bathhouses, theater and concert venues, etc. So there are quite a few spaces. They are almost all indoor spaces, and there is just a very small set of outdoor spaces where the proof of vaccination policy applies, and they are large spaces with capacities of 20,000 persons or more. A couple of other things to note is that the proof of vaccination policy is really attached to your reason for being in a space in some cases. So there are spaces like a community center, for example, where you may be able to enter to do certain things without showing your proof of vaccination, or without being vaccinated, in fact. And then you may have to show that proof of vaccination in order to do other things in that same space. So it's really attached to your purpose for being there. In other spaces, there isn't really that you know, dual I guess, purpose for being in the space. If you're in a restaurant, you're there to, eat in the restaurant, and so it's more straightforward. I also want to note before I move on that what I call the proof of vaccination policy, which is what it is named, is what people refer to commonly as the passport. So when I say proof of vaccination policy, I am talking about what people commonly refer to as the passport. Let me see. Okay. So the proof of vaccination policy applies to those spaces when doing certain things, but there are exemptions to the application of that policy. So people are not required to prove full vaccination to enter and occupy and use spaces if they are under 12 years of age, if they are under 18 years of age and participating in organized sports, training, or certain classes. So, the key there is participating in the activity, and that is an organized activity. So it would not apply to a drop-in sort of activity, and it would not apply to being a spectator for that activity. So it really is just for participating. Also, if you are entering the space to access a washroom, which I know is something that's come up quite a lot, as there has been some concern among people who rely on access to washrooms in certain businesses, whether that be a McDonald's or a Tim Hortons, for example, and then not being granted access to that washroom due to the application of the policy. That is a misapplication of the policy. That shouldn't happen. Other exemptions are if you need to pass through the space to access, through indoor space to access an outdoor space like a restaurant patio, if you're making a retail purchase, paying a bill, getting takeout. And this is an important one, attending a wedding or funeral service. But again, it is only for the actual formal rite, R-I-T-E, associated with that wedding or funeral service. It is not for any subsequent or prior social gatherings, meals, anything like that. And also if you need to enter to perform work, or if you are in possession of a medical exemption certificate. I will say that you may possibly have questions about medical exemption certificates. I'm sure you're being asked about them. I won't be able to speak in great detail about them, except to say that their use is being very limited. So there will be a very limited range of conditions and circumstances under which someone will receive a medical exemption certificate. So it is not something that will apply to very many people. So I just want to say that. Okay, so because we're talking about proving full vaccination, so your full vaccination status in order to access these spaces, it's important to understand what it means to be fully vaccinated in Ontario. So the most common circumstance is someone will live in Ontario or Canada at least and receive 2 doses of a vaccine that's approved for use in Canada. So that would be AstraZeneca, Moderna, or Pfizer. I know they come under new names, but let's just stick with those names we're familiar with for this purpose. And in some limited circumstances also, someone may have accessed or been given Janssen, which is also called Johnson & Johnson, which is a single dose vaccine. Any of those circumstances, if you have your single dose of Janssen or your 2 doses of one of the others, you're fully vaccinated clearly. Another circumstance, and this really applies to people who got vaccinated outside of Canada, is if you receive 2 doses of vaccine not approved for use in Canada, or 1 or 2, I'm sorry, if you receive 1 or 2 doses of vaccine, and then you receive 1 dose of an mRNA vaccine here in Canada. mRNA vaccines, I'm sure you're all very well familiar. They are
We can't hear you, Geoff.
Oh, sorry about that. I don't know what happened. Hopefully that hasn't been very long. It hasn't, has it?
Nope, not at all. It was just for a few seconds.
Okay, thank you. So yeah, what I was saying was it doesn't matter whether if you've received vaccine approved for use outside Canada, whether it was 1 or 2 doses you received, it's of no consequence. Either way, you need to get that 1 additional dose of an mRNA vaccine and you're considered fully vaccinated here. Also, there are some vaccines given in the world that either require 3 doses or the the government or the body that gives the vaccine can decide that the vaccine requires 3 doses. So if you are someone or you come across people who have already received 3 doses of vaccine not approved for use in Canada, they are also considered fully vaccinated here. They are not eligible or expected to get a dose of mRNA vaccine. And then, of course, you're not considered fully vaccinated until 14 days or longer after your final dose of your vaccine regimen. So frequently asked questions we get related to the definition of vaccination. So are there cases where I may need, oh yeah.
Oh, I'm so sorry to interrupt, Geoff. We did have a question in the chat that pertained to your last slide. So I hope it's okay to.
I'm happy to stop and take questions. So I'll pause after each slide just to see if there's a question.
That's wonderful. So I believe it was Julie that had a question. So sorry, I'm trying to find it again. Does someone with Janssen need to get an mRNA dose to be fully vaccinated according to bullet point 2 on the slide?
No, they don't. So I didn't, in the written slide, I didn't really address the single dose vaccine, but Janssen is still a single dose vaccine. I know you may encounter questions now because the United States is starting to initiate.
Sorry.
Oh,
Hello? Sorry. Hello, this is Julie. I don't think I asked that question. I don't know why that's up there.
Oh, that's okay. It might just be a different Julie. So don't worry.
Okay. Well, does she have the same name as my son? My son's name is Jensen.
Oh, no, no, it's a different Julie. Thank you.
Because I took him already. He's got both his Modernas.
Okay.
Good, good.
Anyway, I think I've answered the question. No, it doesn't require a second dose.
Okay, we've got a few more questions, Geoff. One is actually pertaining to the noise in the background. Is there potentially noise in your household?
Oh, my wife is on a meeting. Yes, we do work in the same space. What I can do is move to another room. So I will do that. And you can, in the meantime, if there are any other questions, you can throw them at me.
Thank you so much for that. Okay, so we've got another question about J&J. So if someone received 1 dose of J&J outside of Canada, is that considered fully vaccinated?
Yes, it doesn't matter where the vaccine was received. If it is a vaccine that was approved for use in Canada, then it's the same as if you got it in Canada. It really doesn't matter where it was received.
Perfect, thank you. That's all for the questions in the chat at this moment.
All right, so I've moved. I'll leave my video off because I'm in my son's room, which is really our spare room. He's just staying with us for a bit, so I'll leave the video off, but I'll continue. So we do get some frequently asked questions that I'll address as we go through the presentation. One of them is, are there cases where I may need to have 2 mRNA doses if I received a vaccine not approved for use in Canada by the World Health Organization? So we get asked that a lot because until about a month, 5 weeks ago, there was a distinction between vaccines not approved for Canada but approved for emergency use by the World Health Organization and ones that were not approved for emergency use by the World Health Organization. And in some cases, you did need to restart your vaccine series here in Canada. In other words, get 2 doses of mRNA vaccine to be considered fully vaccinated. That changed. So there is now no circumstance under which you need to get 2 doses of mRNA as long as you can demonstrate that you did receive at least 1 dose of a vaccine outside Canada. You need to be able to provide a valid receipt for that dose, and it would be recorded as an out-of-province dose by my team. As I said that earlier, my team does that work. So that would be the only circumstances. And we do unfortunately have some people in that circumstance. So this includes, I'm aware of some people who have recently come from Afghanistan who were not able, they did receive vaccine there, but were not able to bring any proof with them. And unfortunately, in that circumstance, you will have to restart your series. And all of the science and guidance says that that is a safe thing to do, but it was determined to be not necessary, and that's why it's not a standard practice anymore. And am I exempt from the policy if I have natural immunity to COVID because I've already been infected by COVID? And so that's, you know, in other words, under the proof of vaccination policy, if I've already been infected, does it apply to me? And it does apply to you, and no, that does not provide the basis of an exemption to following the policy. Any questions? Okay, move on. So moving on to vaccination receipts and records, and what can I use as a vaccination receipt or record? And we get a lot of questions about this. So the following vaccination documents are acceptable as long as they confirm you meet Ontario's definition of fully vaccinated. So that's the definition I went over a minute ago. So first of all, any paper receipts that someone has received right from the beginning of the vaccination program are still fine as forming part of your proof of vaccination. That's totally fine. Previous versions of electronic or printed Ministry of Health vaccine receipts, which are maybe the most common form of receipt that people have received, are still totally fine. Electronic or printed enhanced vaccination record with the QR code, which has just very recently been released, obviously is fine, but it's not necessary. And finally, international paper and electronic receipts and records are also fine to use under this policy. In fact, I mentioned that my son is here visiting. He was vaccinated and has lived in Newfoundland, and he's been using his Newfoundland receipt, and he's had no issues at all. If the receipt is not in English, so if someone, say at a restaurant, is not able to, you know, pull from looking at the receipt that, you know, the type of vaccine received, the date it was given, et cetera, that it is a second dose, these key pieces of information, then under the policy, the expectation is that you would have that information translated and show the translation along with the receipt. Now, one thing I will say is that this is a policy that is applied by many, many thousands of different people across Ontario, because it's being applied at restaurants and other spaces. It's not being applied by government. It's not being applied by the city. It's actually businesses and operators of spaces that actually have to understand the policy in order to apply it properly. So certainly you will run into situations, or some people will, unfortunately, where someone doesn't fully understand the policy. So what I'm sharing with you is what the policy says, understanding that there, again, may be some people who aren't very well informed about it. Any questions?
Geoff, there's one question. I think you might have answered it, but the question is, as it relates to the vaccine passport, I'm guessing that passports or receipts from other areas will have a different look to them. Will that change so that there is a continuity across the world for Canada?
Yeah, what a great question. So there are different vaccine receipt standards, I put in quotation marks standards, out there. And I'm going to talk at the end of the presentation about the federal government's initiative to bring Canada under one standard. And the standard they're using is being applied by some other countries, including the United States and others. I can't give you a full list, but it is not the only standard in use in the world. So for example, Europe uses a different standard. However, and you're certainly right. I mean, I've looked at receipts from all over the world because we are documenting out of province vaccinations, my team is, and there are so many different formats and looks and feels. Now, even though Canada, maybe I'll address this further later, but I will address the new Canadian or pan-Canadian record toward the end of the presentation. So maybe I'll get into that then.
Thank you.
Okay, continue. So how to get a vaccination record? There are a number of different ways. So one is if you have a green photo Ontario health card, You can download your enhanced vaccination record with QR code at any time through the provincial website at covid19.ontariohealth.ca. This does require putting in the numbers into the website on both the front and the back of your card. So if you had an Ontario Health card, but you've lost your card, but still have the number on the front, which was actually my situation until recently, you can't use that portal. You need to have the actual card or have a record of the numbers on the front and back of the card. If you have an older Ontario Health card, not the green photo health card, oh wait, sorry, I'll just move on. Yeah, an old red and white health card, then you can't use the portal because the old card didn't have those numbers on the back, I guess, that you would need. So in that circumstance, you need to request the vaccination record by phone at the number you see there from the Provincial Vaccine Contact Center. Then, of course, we know many people do not have Ontario Health cards at all. In that circumstance, you would also, just like someone with an older red and white health card, you would request your vaccination record by phone from the number you see there ending in 3900. However, first you would require something called a COVID ID. A COVID ID is a number that must be issued to someone without a health card number, that it becomes a unique identifier that matches you as an individual to the correct health card file in the Ontario system, the COVAX-ON system. So in order to request a COVID ID, if someone doesn't already have one, many people do already have them because, again, if they needed to, if they wanted to get vaccinated at one of our city-operated mass immunization clinics without an OHIP card, when we were still doing vaccine bookings, now it's walk-in, it's not the same, but back when we were doing bookings, you would have been given a COVID ID at that time. So hopefully you still have it. But if you no longer have it, you need to be reminded what it is, or you need one for the first time, you would call the Toronto Public Health Hotline at the number you see there ending in 7600. That will basically put you in a queue that my team works through, and will reach back out to you to provide that number to you. Unfortunately, currently, because demand is so high, we do have about a 3-week wait for that service. So if you were to call today, you would expect to wait about 3 weeks before we could get back to you with that. Any questions on that? Okay, I'll move on. So another frequently asked question about this one about enhanced vaccination record with QR code. So will other forms of vaccination receipt and record be accepted now that the QR code form of vaccination record is in effect? Yes. The QR code is a convenience and it's not a requirement under the proof of vaccination policy at all. There is no indication from the province that they plan to change that they plan to make the QR code the only eligible form of record. So, so please use whatever form of proof of vaccine that you have. How do I download the app that is needed to use the QR code? So you as an individual do not need the app. You also, when you get the QR code, you won't be able to, like if you scan it, you won't be able to see your record by scanning it. It's only businesses and other spaces that are responsible for making sure that only people who are vaccinated enter those spaces that will have access to the app and can read the QR code itself. So you don't need, or really don't have access to the app as an individual. Does the vaccination record with QR code expire after 5 days? We get asked that a lot because one of the ways that you can access your vaccination record that I actually didn't talk about on the other slide was you can be, well, it kind of did. So if you were to call the provincial number and request your vaccination record, what they would actually send you is a link. And that link is something you would click on, and then your record would appear and you can download that record onto your computer or phone or print it or do these sorts of things. That link expires after 5 days. And that has led a lot of people to thinking that their record actually expires when it actually doesn't. Once you've downloaded it, you have it. If you ever need, if you don't download before that link expires, or in the future you need the link again, you can call that same 3900 number, the province, and they will send you a new link. Any questions?
So Geoff, we have two questions. One is, does the vaccination receipt for those that have no OHIP card have their COVID ID?
So does the vaccination record have the COVID ID on the record? That's a good question, and I don't know. I've never been asked that. I have never looked for that, and I will have to get back to you on that.
Okay, great. I have one more, and then someone would like to actually unmute and ask their question.
Sure.
But Laura had a question. I think it was in reference to your last slide, the previous slide. What if the person does not speak English? So I guess, yeah, if it's all of the proof of vaccinations in English.
Oh, I see. So what if the vaccine receipt is not in English, vaccination record, and they don't speak English? Is that?
It just says, what if the person does not speak English? If Laura would like to unmute to ask her question, that would be great.
That would be helpful.
So Laura added in the chat, and they don't have a health card. Laura, would you like to unmute and ask your question?
Oh, well, I will take a stab at it. By all means, though, Laura. Well, okay, I'll give Laura an opportunity. I think I know, but sure.
Matt mentioned maybe this is in respect to the hotline.
Yeah, that's what I was thinking. So if someone who does not speak English needs to phone to request the vaccination record, how do they do that if they don't speak English? So both the provincial vaccine support line, that 3900 number, and the Toronto Public Health hotline, which is that 7600 number, both of those services have multilingual capability. So you know, and the operators, I can't say exactly how they navigate that, but the operators have a lot of experience doing that. So I know at the city, we use the 911 service. So the exact same service that you would access if you called 911 and didn't speak English, you got connected to an interpreter. We use the same one at the hotline. So you can absolutely get service in many diverse languages.
Okay, so before I pass it over to Sebastian, Matt made a comment that the thing about the hotline is that you need to jump through several hoops in the hotline, which are all in English. If you don't speak a word of English at all, it's actually not possible.
Right, and I hear that. I have heard that before. I will bring that comment back. And you know, I just can't really speak any more than that, other than to say I'll bring it back about the hotline service and why they do or do not operate on that model that you just described. But I have heard it before, and I appreciate the comment.
Thank you. Sebastian, would you like to unmute and ask your question?
Yeah, absolutely. So I have a question about the kind of distribution of the QR code. It seems that there is the hotline, and then I know that some agencies like Access Alliance do have like ambassadors who can distribute that code. And then I also know that like I work in the downtown east side with Shoreborn Health, that some of our Shoreborn Health staff, medical staff, doctors, do have access to generating the QR code. Now, what my question is it seems that our agency, the St. James County Community Corner, is having a hard time actually getting an ambassador to get access to one of the QR codes, which would, or sorry, not the QR codes, but the COVID ID. And I'm wondering, like, how expansive are your partnerships with agencies, and how, like, what is the plan to like build synergy with agencies that actually have community connections in order to distribute COVID IDs so that they could work with folks that they vaccinated and have built trust with in the community?
Yeah, thanks, Sebastian, for the question. Yeah, so you are correct that we have longstanding, going back several months, partnerships with FCJ, Access Alliance, and I think 4 other agencies, so several other agencies that do provide COVID IDs and have been doing that for quite a while. And you can continue to refer people to these agencies, although we have had to remove through their conversation with them, we have had to remove them from being a channel that we really promote because of the volume of demand that they've received. The province, so everything we do in COVAX, so COVID ID is created inside the COVAX computer system, and everything we do in that we do through an agreement with the province because it is their system, and they set policy for its use, and they have limited sort of the ability to generate COVID IDs to the public health units in the province. So we have certainly raised this as being challenging for us because we have limited capacity. We are actually adding capacity. So we had someone start yesterday. We have another person starting next week. It is challenging though. We don't like that someone has to wait several weeks, but we would say that there is an opportunity to get the COVID ID through a trusted agency rather than through the City of Toronto, if that's preferred. Expanding that network is not something that I see actively happening right now, but I do appreciate what you're saying.
Thanks, Geoff. Before I pass it over to the two people with their hands up, one quick comment from Kim. When we send out your presentation slides, could you include the Toronto Public Health TTY number?
Yeah, sure. I apologize for that. I will do that.
Thank you. Okay, so the next person with their hand up is Imran.
Thank you. Geoff, thank you very much for taking my question. I wanted to kindly ask about places that will want to implement proof of vaccination for attendance. How do they go about getting the business QR or the scanning for the QR code since they're not really business related?
Yeah, so my short answer to that, unfortunately, is I don't know. That would be a question that you'd have to bring to the province, or we'd have to bring it on your behalf. So I do know that the province has a plan that I'm not let in on and I'm sure they have already implemented and rolling out that app to businesses that are required to have people prove vaccination status before they enter. What I couldn't speak to though is for another space that wanted to make it a requirement and wanted to use the app as part of doing that when they didn't have to. And I'm not even certain whether that is something that would be possible. It's just not something I know, unfortunately.
Sorry, can you please take that then to
Sure.
your table?
What I'll do is I'll try to get that answer for you.
So kind of you. Thank you.
Thank you.
Great. So the next question is from Anissa.
Thank you. My mom tried to prove her vaccine through the app, and she got both of her vaccinations, and she has the receipt through her email. However, when she tried to put her information in the app, it said that it didn't have her history. And this is the same for my coworker as well. So what should they do?
So when you say the app, so I'll just say again, so when you receive your vaccination record with the QR code, or your mom does in this case, if you or she had tried to scan that QR code and see the vaccination record, that won't work. You won't be able to scan it and see the vaccination record. It will not show it to you. But if a business or the operator of some space where proof of vaccination is required scans that vaccination record, they have the app that allows them to read, to access the record that the QR code links to. So does that answer your question, or is that just your question?
I mean, when for the app, when you're trying to prove your proof of vaccination and like with the QR code and like when you go out, like it says it doesn't have her information.
So what you're saying is she may go to a community center or a restaurant where someone scans it, and then that person scans it and says, oh, this doesn't actually show that you're fully
She's
vaccinated.
trying to get her QR code, like when like the proof, and it has like your information and the barcode.
Yeah.
But when she tries to do it, like put her information, like her health card number and everything, like it says they don't have her information.
Okay, well, if what's happening is the QR code is not linking to, like, it is linking to her record, and her record is not showing that she's fully vaccinated when she is, and especially if her vaccinations were given here in Ontario, then that there is an issue. There is a technical issue there that should be looked at. And my advice in that circumstance would be to either have the place where she was vaccinated look at her record, and maybe there was a mistake made when something was being entered. That does happen. Or if that's not possible, you can call Toronto Public Health's hotline, the 7600 number, and they can have someone, it's not my team, but someone on another team take a look. So, you know, if the issue is that there's an issue with her record, then that could be addressed, and that is possible. But if it's the QR code, I just can't think what that issue would be. I don't think it's really about the QR code. It might have been just a data entry error.
Do you mind repeating the number for the public health?
Sure. Yeah, I will just go back. Sorry, there it is. So it's 416-338-7600.
Okay, thank you so much.
So Geoff, I'm just going to allow one more person who has their hand raised. There's just one to ask a question, and then let you move on, because I know that you have a bit more of your presentation to go. So the next person is Kashmira.
Sure.
Hi, I would like to hi, my name is Kashmir, and I would like to ask that the vaccine passport or the proof of vaccine in Ontario is valid until March 2022, or it's more? Because some of the youth, they was ready to take a vaccine and now they are not agree, because they say that it's only valid till March 2022, and after that you don't need any proof of vaccination. So is it true?
Yeah, Kashmira, I actually have slides on that. So I will get to it, I promise. Maybe I should move on and get moving toward those slides. We'll answer the question. Is that okay?
So it's only valid till March, right?
It's more complicated than that, I would say, but they are correct that the province did make an announcement on Friday that states that in March, there may be an end to the proof of vaccination policy. But again, I have a slide on that, so I'm going to just talk a little bit more about it when I get there.
Okay, and the second one, it's like if somebody came from their back home country to the Ontario, and they already took their 2 vaccination at their respective country, and do they need to take 3rd one here, or it's been canceled anymore?
No. So if they receive vaccine that isn't approved for use in Canada, so in other words, if they receive the vaccine that is not either AstraZeneca, Pfizer, Moderna, or Johnson & Johnson or Janssen, if they receive vaccine that is something other than those 4, then they do need to get 1 dose of either Moderna or Pfizer here to be considered fully vaccinated.
So when they come from their back home to the Canada as a student or as a newcomers, on that time on the airport, they allowed them, or the immigration allowed them to come, and they don't ask anything. They need to take 1 more dose. But when we approach them, we say that, okay, you need to take 1 more dose. So how do we?
Well, yeah, I can't speak to the immigration process, but I will just say 2 things to that. One is no one has to take a vaccine, of course, as you know, if they don't wish to, but of course they will be restricted from access, eating in restaurants, all of the things that you need to prove your vaccination status for, they won't be able to do if they don't. And there may be impacts on their employment too, because more and more employers are requiring full vaccination. So, those are realities, but in order to be considered fully vaccinated here, they actually do need that other dose, and there's just no getting around that.
But see, with those back home 2 doses, they are going out, they are working, they are going everywhere. They don't have any issue with that one. But when we approach, we ask them, no, if to be fully Canadian vaccinated, you need to get 1 more dose. And they say that they are working, they are going out, and they are showing their true vaccination from the back home. And it's okay. They never get stopped anywhere.
Okay.
So why do they need to take 1 more vaccine?
Well, they should not be, again, I will say, because you haven't said that for certain these people don't have vaccines that are approved for use in Canada, but if they weren't, so if the vaccine is not Pfizer, Moderna, AstraZeneca, or Johnson & Johnson, if they're not those, they should not be able to access spaces like sit down and eat inside a restaurant, be a spectator at an event in a community center, at a sporting event or something like that. They should not be able to do those things under the provincial policy. If they are able to do those things, it's because the spaces where they're going are not following the policy. And obviously I can't speak to why that would be. I can only tell you what the policy is.
Thank you, Geoff. I think we need to move forward. There are some people that need to leave at 1:30.
Okay, great. So I just want to very quickly touch on acceptable forms of ID because there's been a lot of attention to this. So an acceptable form of identification under the policy says that it needs to be issued by an institution or public body. There's no further definition of what that means. It does have to include 2 required pieces of information. It needs to include a name and a date of birth. And under the policy, the name and date of birth on the ID you use needs to match the name and date of birth on the vaccination record you show. ID can be expired if it was issued by a government in Canada, Ontario, or another, so Canadian, sorry, like a national ID, like a passport, an Ontario ID, or sorry, I'm wrong, sorry, I will start over. If the ID is not expired, so it's still valid, it can be issued by a Canadian, Ontario, other province, or another country and be fine. So you can use ID issued outside Canada if it is not expired. If it was issued by Canada, so federally, like a passport, a Canadian passport, or Ontario, like an Ontario birth certificate, for example, you can use those ID even if they are expired. But unfortunately, the province is not allowing for the use of, let's say, international, so a Venezuelan or a French ID if it is expired. Examples of the sorts of IDs that are acceptable are here, but these are just examples. This isn't an exhaustive list. Should I move on?
Yes.
Okay. I want to very briefly mention out-of-province vaccinations. I already have spoken to it, so I'll move on quickly from this. But if you do encounter people who are vaccinated, either 1 or more doses outside Ontario, please encourage them to have those vaccines documented here in Ontario, because that is what will allow them to get that Ontario vaccination record. Here's the link to the where you will find the survey, which is what needs to be completed in order to request that the vaccine be documented. So yes, please do that. And frequently asked questions. So getting an mRNA dose after being immunized outside Ontario, if required. Do I have to wait until my out-of-province vaccination record in Ontario is recorded in Ontario before I get the mRNA dose I need to be fully vaccinated here? We get that question a lot. And the answer is no. Please, if you need that mRNA dose and you're eligible for it, so that is to say the gap between your last dose and now is long enough that you're eligible to receive your new one, please go ahead and do it as quickly as possible. My advice is to go to a City of Toronto operated mass immunization clinic, because you are most likely not, that's where you're least likely to run into any problems with that, because the city staff really understand this policy. We have had people with issues at pharmacies where pharmacies have not given the dose because it is in fact documented yet in Ontario. And if someone goes to a City of Toronto operated clinic and still needs a COVID ID, and even still needs their out of province vaccinations documented, they can get all that done at the City of Toronto operated clinic. You cannot get it done at other clinics, including pharmacies and hospital clinics, but at City of Toronto clinics, you can get all of that done when you visit. So you don't need to then wait for the service to be provided otherwise in another way. Okay. So I am now going to just comment or just take you through quickly the announcement that the province made on Friday, which is about, they're calling it an announcement about the reopening of Ontario and services in Ontario. And it does speak to a question I had a minute ago about what's happening in March. So first, already the capacity limits and physical distancing requirements in some indoor spaces have been lifted. So restaurants, bars, other food establishments, and other spaces that you see there under October 25th. You still do need to prove your vaccination status, so you're fully vaccinated, and that's what I say in red up top. This is all under the proof of vaccination policy, but you can now, the restaurants and other spaces can now fit more people into those spaces. On November 15th, that will apply to all spaces under the proof of vaccination policy. The capacity limits and the physical distancing limits will no longer be in effect. That's phase one, okay? Then the next phase comes in January. But what I want to say about what's happening in January and beyond is that the province says that this all depends on the state of the pandemic at that time. Does the data support further loosening of restrictions? And I think we've seen a number of times, quite a number of times, let's be honest, that, you know, there have been predictions about what will happen further out. And then the pandemic, you know, the numbers have not gone in the direction that everyone wants them to. And you know, that time frame has not worked out in the way it was predicted. So I think when we talk about January, February, March, we have to realize that these are targets, but they may not sort of unfold on the timeline that the province has set out if the pandemic, you know, we see another wave, for example. So if supported by the data, on January 17th, we may begin to remove capacity and physical distancing limits in spaces where proof of vaccination is not required, including outdoor spaces, and remove proof of vaccination requirements for some spaces, including restaurants, bars, and sports and recreational facilities. So this speaks to the question earlier about, you know, in March, will we see the end of proof of vaccination policy? In fact, in January, if things go the way the province is hoping, I guess, we could also, we could already start to see some of that lifting of proof of vaccination requirements in some spaces. And then February 7th, it will be added, you know, it will be applied to more spaces if things go the way the province hopes. And then on March 28th, may begin to remove the remaining public health and workplace safety measures, including wearing face coverings in indoor public settings and proof of vaccination in other spaces. So yes, the province has made the decision to publicize now an intention, if the pandemic, you know, allows it, to continue to lift these, to start lifting these measures. Is it a good idea? I'm not going to comment on that, but it is a decision, and I just wanted to make sure people were aware of it. But I really do emphasize that do not take these dates to the bank and assume that they will happen just as they're stated here in the longer term, January and beyond. And I'm almost there. Finally, will there be a federal vaccination certificate? So the federal government has just announced that it is working with all provinces to develop one standard vaccination certificate that will be used by every province in Canada. Currently, that's not the case. The certificate will share key characteristics with the enhanced Ontario vaccination record. So the record that you're getting now with the QR code, what we call the enhanced records, that is essentially, I think, the format that you'll see adopted across Canada with the QR code. It will comply with what's called the Smart Health Card Standard, and that is one of those international standards for these health records that the United States also uses. But as I said earlier, not every country uses it. However, the federal government has said that it's confident that our record under this standard will be accepted at all, or certainly most destinations around the world, even though some of those destinations may use a different standard themselves. And use of the certificate will be mandatory for international and domestic plane travel starting on November 30th, but a couple of caveats. Beginning on October 30th, those aged 12 and older traveling within Canada or departing internationally from a Canadian airport will require proof of vaccination. Although there will be an opportunity for an alternative for the first month where someone may show a molecular COVID test result showing that they're not infected with COVID, and the test has to have been taken not more than 72 hours before the trip starts. So I know that was a lot. Happy to take any additional questions.
Geoff, are you able to stay for an extra 5 minutes at the end of the session in case people have more questions?
Sure.
Thank you. So what I'm going to do is just run a quick poll because I know there are some people that do need to leave. So if people could just take 2 minutes to answer the poll that's on the screen right now, can someone just let me know if you can see it?
Yeah.
Thank you. Yes, so we'll just keep this poll on the screen for about 2 minutes, and then we will luckily have Geoff stay with us for about 5 extra minutes so that you can stay on and ask questions if you have them. There are some questions from the chat that I've been copying and pasting to send to Geoff after the session as a follow-up. And if you'd like to put questions in the chat and you have to leave, please feel free to do so, and we will work with Geoff to get them answered the best we can. The other thing I wanted to mention is if you have ideas for future sessions, we have about, I think, 3 more that are left. If you have any ideas for topics that you would love to see us at Social Planning Toronto, myself and Charles, to work on implementing for you, please put your ideas in the chat. Thank you in advance for that.
Geoff, I just have a quick question, please, while the poll is undergoing, and I think you answered it, and that has to do that with the mask mandate. It is still in effect for all places, regardless whether they are under, requiring proof of vaccination or not.
Absolutely, yes. The mask mandate is still in effect for, yes, all the spaces that it has been all along. No change there.
Does anyone else have a question while we bring the poll to a close for another minute?
Geoff, it's John Massa. I have a question. So you need the 2 pieces of the vaccine receipt and your personal ID, yes?
So not necessarily, John. If you have one vaccine receipt that shows that it is your second valid dose, that's the receipt for your second valid dose of vaccine, approved for use in Canada, or you have one vaccine receipt that shows that you comply with the full vaccination policy, you only need to show that receipt. So it's only if there are certain odd circumstances where you might need to show 2 because one doesn't prove, but generally you should only have to show 1 along with the ID.
No, that's what I mean. Like, you need to have the vaccine receipt and your birth certificate or your government issued. You have to have those 2 pieces together.
Exactly. And a lot of people thought that when the QR code came out, you would no longer need to, this should have been a frequently asked question actually, that you'd no longer have to show your ID, that the QR code alone would be enough, but that's not true. You do need to still, even with the QR code, show your ID.
Okay, thank you very much.
Thank you so much for that. I am going to bring the poll to a close. And I believe you'll be able to see the results of the poll on the screen. If you are not able to participate in the poll, because if, for example, you were tuning in by phone, please feel free to contact me and provide your feedback directly. I'll put my email address and phone number into the chat. So please feel free to share your feedback and comments with me directly or even in the chat. So thank you again to everyone for being here today. We still have Geoff with us for a few more minutes, so please feel free to ask questions. We have a hand up from Warda.
Yes, thank you. Thanks so much, Geoff. This was really informative. I'm just saying there's a lot of information given out, and I tried my best to take as many notes as I could. I was wondering from the city, can we get an infographic or a flyer with all these frequently asked questions so we can translate them and send them out to our communities? Yeah, there's just a lot of important information and just another way to present it so we can get it out when people do vaccine outreach work.
Sure. There are actually infographics on, I think, the key pieces, and I think one is just being finalized now. So I will certainly get those out, and then you can let me know if there are any gaps in what I send that are really important for us to develop new infographics on.
Okay, thank you. And also, just one thing that stood out to me when Kashmira said that after March 2022, the proof of vaccinations will no longer be required. That's really going to put a dent in the work that we do. So any ways to address that would be helpful as well.
Well, that's why I really emphasized, well, I guess you mean in terms of like infographics and things, but I will bring that back. I don't know the answer to whether we can do anything with that, but what I just really want to do is emphasize again that people who are banking on those dates, actually, working out the way the province has presented it, may be disappointed. So if you're saying I'm not going to get vaccinated because I think I can wait till January or wait till March to do the thing I'll be able to do then without vaccine, you may very well be disappointed, and you could very well wait, a number more months before you're actually able to do that, because we've seen again and again that the pandemic doesn't play by the schedules that we set out for things.
Right, thank you. That's a really good point. Thanks.
So Geoff, there is a question in the chat. Just to confirm, when someone is showing proof of vaccine, they also have to show their ID.
Absolutely, including with the QR code version, you still need to show your ID.
Thank you. I saw another question I'm still trying to find. In the meantime, does anyone have a question they'd like to ask directly? Okay, while we're waiting for other questions and hands to go up, I found one in the chat. For nonprofits who require proof of vaccines from clients, how do we access the business scanning QR code app to access records that QR code links to? If a client provides a proof of vaccine without the QR code, what do we do?
Well, okay, that's two questions there. So I think the first question, is essentially how do we access that app? And it's very similar to the question that Imam Ali asked earlier. And so I will add that. I think then the two parts of that question is how do we access it? And can a space that isn't required to require proof of vaccination, so it doesn't have to require proof of vaccination, can they require it? Those are the two parts that I will ask. The second part of the question, though, around what do we do if we don't have the QR code reader, you just can review, you can do exactly what everyone did before the QR code came into effect a few days ago. You can just look at the receipt itself and see or the receipts, and see if it does prove that someone is fully vaccinated under Ontario policy. Just do a visual check and then check the ID, and that's all that's required. Even businesses now don't have to use the QR code if they don't want to, as long as they're doing the check of the records.
Great, thank you. I think we have a hand up from Kashmira.
Hi, I would like to just ask one more thing. It's like not more like a question, but one of those our outreach person says that instead of our province is letting people go without the vaccination, if the person who is not taking a vaccine, they could pay from their own pocket every like weekly to check their own COVID test. Like they was giving me a suggestion to put it on that if any policy comes like that, that whoever did not take a vaccine and they are facing for like symptoms, so they need to pay, like OHIP does not cover their test, like when they go for a COVID test, they need to pay from their own pocket. And if they are working, they need to do twice a week test from their own pocket. Is there anything like?
So if I understand correctly, you're saying that there are circumstances where some people who have chosen not to get vaccinated are instead taking tests at their own expense so that they can demonstrate to, let's say, an employer that they are safe to go to work and the employer accepts that. Is that what you're saying?
Yes, that's what they say, is that instead of they let them go, they need to check their COVID test twice a week and they need to pay from their own pockets.
You're asking if there's a possibility that the
Yeah.
government, the city or the provincial government could pay for those tests. Is that right?
The city doesn't need to pay. The person who does not take a vaccine, they have to pay from their own pocket instead of the OHIP.
Right, but are you saying, could that be changed? Is that what you're asking, so that the city or the province does pay for the tests?
Yes, that's what I'm asking. That is there any way that instead of the province, if the person can pay their own, like who does not take a vaccine, they go
Right.
for the test, they have to pay their own, they have to pay the cost of the test.
Right. So Kashmira, I can say that with confidence, without having to ask, that the city would not take on paying for those tests, because the city's focus is not on facilitating people not getting vaccinated. It's our interest is in having people get vaccinated. And I can't speak for the province, but I'm quite certain that the province would give the same answer, that, you know, the solution that the province would say to that situation would be to get vaccinated rather than to keep taking tests and not get vaccinated. And I don't mean to be dismissive of you know, what you're raising there, and that, you know, people really have concern about vaccination and really would like to have that alternative and have the government support it. But, you know, it just isn't something that that will happen currently, because all governments right now are really focused on encouraging people to get vaccinated rather than paying for alternatives to vaccination.
Yes, yeah. Thank you.
Thank you, Geoff. So we have one last question from Razia.
Okay.
Just a quick question. I'm not sure even if this is the right platform to ask that. Are we going to have our bylaw officers to do random visits, surprise visits to those businesses who are not adhering the guidelines from the province? I think this way we can test what's happening and we can move confidently to the next steps, the next stages that we plan for.
Well, Razia, I wouldn't have insight into that, but I can certainly flag that has been asked. I will say that, you know, I spent a little time working at 311 at the beginning of the pandemic because they had so much need. And, you know, certainly the way that that these issues were dealt with was through complaints. So someone, you know, goes to a business, they're not asked for ID and proof of vaccination when they should be. They call 311 or their counselor or someone, and they complain, and that's how most of these investigations happen. But you know, I will certainly bring back that it was asked whether more random approach could be used also, and yeah, if I get an answer, I'll let you know. I don't know if I'll get an answer in all honesty, but if I do, I'll certainly get back to Shahia.
Thanks a lot.
Okay.
Hello?
Oh,
Hello?
Hi, sorry, before you go ahead with your question, Geoff, I sent you a question by direct chat. If you don't mind checking it while you're listening to our last question of the day, go ahead.
Can I ask my question now?
Yes, you can. Thank you.
Okay, so when all this started happening, did nobody ever think of the seniors? I have a pile of seniors that I've been helping. Oh, by the way, my name is Julie. I have a pile of seniors that I've been helping here on the lakeshore. A lot of them don't have computers. A lot of them don't even know what a computer, how to work a computer. They don't know anything about photocopying. They don't know anything about where to go, who to see. There's a lot of stuff that the seniors don't know, and I just feel like there was nothing available for these poor seniors. I mean, lucky I came along because I'm helping a handful and I still help them. I help them every day almost, but the government is so, I don't know where their brains are at. Like they did, this thing came up and nobody thought about people who do not have computers, who don't know how to work a computer. They just assumed that everybody knows what they're doing, and they don't. So it was really, really sad to see my seniors like that, but thank God I was there. But I'm just saying the government had no clue as to when this happened. Like, oh my goodness, we're gonna have a handful of people who don't know what we're doing. What can we do to help them? There was nothing there. You know what I'm saying?
Yeah, no. Oh, sorry.
Oh, no, go ahead, Geoff.
Yeah, no, I absolutely hear that comment. Again, like I said to the last, my answer is not meant to diminish all the barriers that seniors face. And it is so critical that the ambassadors are there as one of the ways that seniors receive support. But I just want to make sure, Julie, that you are aware that through the 3900 provincial number that I shared earlier, and that, I know that you'll all get the slides and it will be in the slides. Anyone can request that their vaccination record, so they can phone that number first of all and get service through phone rather than computer, and then they can also request that the vaccination record, a hard copy of it, a printout, be mailed to them instead of having a link or an electronic record mailed to them. So it can be mailed to the home address, it can be mailed to the address of a family member, or even for someone who, for instance, is experiencing homelessness, it can be mailed to a shelter or a service provider. So that is one way that someone without computer access can get access to that record.
So, okay, so you said 399, they just dial 39, we just dial, sorry, not them, me. I just dial 3900.
Sorry,
That's
no,
it?
I was just giving the short for the last digits of the number. I'll just give it to you now, the whole number, if you're ready for it. I'm just
Yes.
sure. So the full number is 1-833-943.
9 what?
So 1-833-943.
943.
Yep, 3900.
And what's that called again?
It's the Provincial Vaccine Contact Center.
Okay. All right. Yeah, I've just been doing a lot of this on my own, and I've been bringing my computer to them, and I've been taking them to when they did finally get their passport, however they got it, bringing it to. They all wanted them laminated,
Yeah. Yeah.
The seniors, they all wanted them laminated. So here we are dropping off to UPS to get laminated.
Yeah, and that's a good point, actually. They can be laminated. I get that question
Yeah.
a lot. Can we laminate it? Yes, it can be.
Oh, we just did it. We didn't even ask, but they were just like, if this is a card, because the way they saw it, if this is a card, then it should be laminated.
Yeah, for
Oh,
sure.
they're funny.
Okay.
Okay, thank you so much.
Okay.
Thank
Have a
you.
good day.
You too. Thank you, Julie, for raising all those really important issues. And it's interesting to see in the chat that some organizations are purchasing laminating machines. So yeah, really great point that you brought up around accessibility. So thank you again to everyone who is here with us today. I hope you got a lot out of the session. Geoff, thank you to you. You were a wonderful presenter and answered so many questions on the spot. Thank you so much for the helpful information. And thank you also to our ASL interpreters, Anna and Sharon. I know that you stayed over time and we really do appreciate that. Thank you so much. And thanks to Charles for co-organizing the session with us here at Social Planning Toronto. We hope to see all of you at the next session. It's very open. It's just about challenges, sharing all your challenges, your tips, your best practices with each other. So it's quite open. So you can bring anything forward to discuss with each other and try to support each other as peers, as community ambassadors, doing this incredible work. So we hope to see you there. We will send you some more information about the next session. Have a wonderful day and enjoy the sunshine. Take care.
Thanks. It was great to be with everyone.
Thank you, Geoff. Thanks, everyone. Take care.